Hi, everyone. This is Deborah Jennings, and I want to welcome you to our webinar for today from the Center for Parent Information and Resources. Today, we're going to share with you two brand new resources that have been developed by us here at the SIPR. And when I say by us, I mean us, as in all of us, because as you know, our SIPR resources are in response to the needs and the requests of you as parent training and information centers and community parent resource centers. And so we have, for both of these resources, they have come about because of what you have identified for us are needs by your centers in your states and in your communities. The first resource is the resource collection on trauma-informed care. And as we are all very much aware, our families and our children are often needing to make sure that we are addressing the trauma that is being experienced in their lives. These resources not only are about the biological and psychological effects that impact the children's development and how that interferes with children's functioning and relationships and school and life, but it's also about some of the events that also impact children, particularly as it relates to natural and sometimes unnatural disasters. And so we heard from you, many of the states who have experienced this, many of the centers who are working with families and children who have experienced or experiencing trauma, that this is an important need for us to make sure is available for parent centers. The second resource that we're going to talk to you about is our guide to developing and forming local special education parent advisory councils. And this is that we call Advocacy in Action. And this is in response to many of your having an interest in how to organize and to support local groups who are working on improving special education services at the local level, as well as coalescing together across the state to help improve special education programs and services at the state level, and then even further to taking that advocacy to action at the national level. So let me introduce our presenters for today. On the resource collection on trauma-informed care, we have a team of parent centers who are really folks who are on the ground, who are reaching and serving some of our families who have some of the greatest needs, and particularly families who have who are families of children with disabilities who are also foster and adoptive families. So that intersectionality requires some really special commitments, some special people, and to have some special knowledge. And so Kelly Henderson, who is the Executive Director at Forum Families Forward Community Parent Resource Center in Virginia, is joining us, along with Gail Osborne, who is the CPRC Director at the First Parent Center in North Carolina. And their work has been facilitated by the Exceptional Children Assistance Center in North Carolina, which was the Parent Technical Assistance Center for their region. And that is led by Terry Layton and also Laura Weber, who's the Executive Director at that center. And so that team is going to talk to us about that trauma-informed care resource collection. And then for the guide to local CPACs, we have Karen Antone, who is a former employee of SPAN here in New Jersey, and who worked very closely with a team of individuals across a number of parent centers to develop the guide to local CPACs. Next slide. So now I'm going to turn it over to Kelly and Gail, along with Terry and Laura.
Good afternoon. This is Kelly Henderson. I think we have, to start off this section, we have a little poll. So those of you who are joining us by your computer, we would love to have some feedback on this poll.
Miriam, you need to put the poll up.
There we go. So we would like you to start us off by rating your personal familiarity with the topic of childhood trauma and trauma-informed care. And you may, in this case, mark all that apply. So the first three are really your level of familiarity, and then we have two other options for you to fill in. So we're going to give you a moment to do that. And I think Miriam is going to help us get our poll results. Okay. So we have quite a range. That's wonderful that we have folks that are about 27% are familiar with this, very familiar with this topic, 36 somewhat, 11% not familiar, and 27% indicated that there is great demand in their community for trauma information. And no one said that it's still a developing area. So that probably means that a lot of you parent center staff are really feeling the need to be able to develop a repertoire of knowledge and skills and resources in this area. So I'm going to let Gail describe a little bit about how our collection, which hopefully will be a great tool for you, was developed.
Hi, this is Gail from Asheville, North Carolina, and just kind of want to share with you how we came about this project and how everything came together. So a little less than a year ago, we were contacted and just put feelers out all over the country. Most of you probably received an email where we just said, send all your trauma resources, send everything that you have. Don't filter them, just send them to us. And so we ended up getting roughly over 600 different topics or different items to sort through. They ended up going through, and they went through two different processes of being organized and looked at. We went through and looked at, the videos. We categorized them by videos, by PDFs, by, just handouts that you can give to people. We created many descriptions. We wanted you to be able to have an item that you could just put your hand on. If you had a topic of, foster care trauma, or if you had a situation where you needed to put information in someone's hand for school-based trauma, anything like that. So we ended up putting it all on a great big spreadsheet where you can actually sort through and find something very quickly. So going on to the next slide. We broke them down into 5 categories, and we really struggled with how to break this down because there was so much information. It was so rich with just so many topics. So we broke it down into 5. So basic information about trauma. What is trauma-informed care? What does it look like? Number 3 was trauma in specific populations. So, and we'll talk a little bit more about that later on in the webinar. And then building trauma-informed schools. And then 5 was responding to disasters. And so then what kind of resources? One-pagers, there were infographics, there were briefs, actual research briefs, videos, fact sheets, training materials, websites, webinars. We've got them even broken down by Spanish and other language resources. Lots of information in there.
Thanks, Gail. This is Kelly again. I'm going to talk about the first of those 5 topics, the first of the 5, I guess, sub-collections is what we sometimes call them, and that's the basic information about trauma. And since some of you indicated in your poll that you may be new to this topic or somewhat new to this topic, this is a great place to start. There are 6 focus areas within this sub-collection. Generally, these materials are designed for a wider audience, so very introductory information designed for perhaps a lay audience. Next slide. So here we're going to take a deeper look at that first focus area of introductory information on trauma. There are just 2 examples here. One is a booklet, a PDF booklet, as well as a 4-minute introductory trauma video. So you can see that there's a variety of types of resources under each focus area. In other words, we suggest you think first about the topic, and then within that topic, you should be able to find a variety of types of resources that are going to best meet your need. Next slide. A second focus area within, again, this first sub-collection, how parents and caregivers can support and help children. Again, a great example of some of the types of resources that you may be looking for at your particular center. First, we're featuring these 2 resources. The first is a recovering guide to that would be appropriate for impacted parents and caregivers. In other words, parents and caregivers who are trying to support their own children after a traumatic event or series of circumstances. And that's a great example of a document that would be helpful directly for parents. And then the second document we have here is a user-friendly fact sheet. It's short and very easy to read. That's focusing on what kinds of parenting skills you might want to bring to bear when you are raising a child who has experienced trauma. Next slide, and Gail, you're going to talk about our second sub-collection.
So trauma-informed care. And so as your centers and agencies, we want to be more trauma-informed. And so this would be where you as an agency could go to find more information about that. What is in trauma-informed care? What websites could you explore? Videos? As an organization, there are checklists in here, like, are you a trauma-informed organization? There's an actual checklist where you can go through, and each of your employees can go through and check that off. And it's just amazing what resources are in there for that, for your whole agency. Next slide. Another good trauma-informed organization resource would be Walking the Walk. It's a 2-page handout that tells what's needed for an organization to become trauma-informed. So once you identify, are you or are you not? If you're not, then this would be a step-by-step to become trauma-informed. So moving on to the next area, which would be number 3, trauma in specific populations. So this one has some really unique information about trauma and people with disabilities, trauma for Native Americans, trauma for youth, and trauma in youth and juvenile justice. And one big moment that I had in collaborating all of this information was considerations for IEP meetings. And I actually had a case rolling right at the same time where a parent had contacted us, and she was saying how IEP meetings were traumatic for her. And so I took this resource we had received from one of the parent centers, and I forwarded this information to her, and it resonated with her. And she's like, this is exactly what I've been trying to say, that the IEP meeting is traumatic. And, you know, again, this resource is found in there. The other one is trauma sensitivity during the IEP process itself. And so that walking through the IEP process with the parents and how a team can be more trauma sensitive. So Kelly, moving on to subsection number 4.
Yes, so this sub-collection focuses on schools. And we know that many of our clients and recipients of our services are parents and caregivers, as well as youth. But this is a great sub-collection to provide the tools that parents and caregivers may want to in turn share with school providers, as well as, of course, the school providers and educators that we work with directly. So this sub-collection is really focuses on resources for adopting and strengthening trauma-informed schools. The resources include those for understanding what a trauma-informed school is, what are those characteristics, and many resources that can be delivered and provided directly to educators, in other words, written for educators. Trauma-sensitive practices are the focus of many of the resources in the classroom section. Specific resources for school leaders and for teachers in terms of training tools for their professional development is the topic of the third focus area. And then finally, the fourth focus area under this sub-collection, self-assessment and other resources, are a couple of tools that can be used as self-assessment instruments for schools and other organizations to evaluate their own readiness for being trauma-sensitive and trauma-informed. So these are really great opportunities and resources for families to share the information with the educators in their life. Often we find at our work, at least on a day-to-day basis, that parents and caregivers are beginning to understand and have a very good grasp of some of the challenges related to trauma, some of the signs and symptoms of trauma, and strategies for addressing the trauma in the school and at home, but they have a difficult time communicating that need with the educators in their children's life. And so these are really great tools to share. I wanted to point out before I pass this back to Gail that across the bottom of each of these slides that you've just seen is the specific URL for the sub-collection. So each sub-collection, in this case, Building Trauma-Informed Schools, has its own URL, but there is also a landing page that connects you to all of the different sub-collections. And at the bottom of each sub-collection, it will send you back. SIPR has done a great job of being able to make a very usable mapping in terms of how the web pages are displayed. So you can move amongst the sub-collections very easily. And I think Gail is ready to talk about the fifth sub-collection.
So responding to disasters. So in the middle of collecting these, the United States was going through wildfires out west. We had hurricanes being hit in the east. And so a lot of these resources were coming in live, and there were centers that were actually requesting. And so preparing for natural disasters, responding during a natural disaster, and then afterwards, support and recovery. And so there's lots of resources in there. If you'll move to the next slide. There's 3 examples that are in there: making a checklist for planning, SAMHSA's disaster app, and it was pointed out to me yesterday, I think it was by Lisa Cooper, that you can actually put in there like what to do during a tornado, what you can do during a hurricane. It's very specific how you can ask for information from the app. And then that's for during, and then afterwards, parent guidelines for helping children after disasters. So lots of good information in there. So then the next slide, now that we've given you what information is in all the resources, we want to know what you're most interested in using. So we'll put the next poll up. So which of the 5 resource pages do you think you'll explore first? Which sections? So I'll give you just a minute to respond to that. All right, and let's look at what area you guys are going to look at first. Trauma in the specific populations came out at 36%, and building trauma-informed schools at 30%, with third place going in what is trauma-informed care, and then basic information about trauma coming in fourth place at 11%, and then responding to disasters at 0%. And I'm going to take a leap and say that responding to disasters will probably go up the next time that disasters hit the United States. All right, moving on to the next. And Kelly? No, this is me, I'm sorry. So ways that you can use this collection for yourself, to learn more about the effects of trauma, to learn about providing trauma-informed care for yourself when you're working with families, for your families in your center, for how you're supporting them, to share resources, to find resources for families in different formats. And when you have families that you can shoot a webinar to, or you can shoot a PDF to, or, you know, one of the things one center is already doing is posting things to their Facebook page, you know, to support families in a natural disaster just before one or just after one. And then for your center, staff training, there's actual training materials in there. And then to build capacity as a trauma-sensitive center. So lots of information that you can use for that. All right, Kelly?
So I think this is the time where we have a moment or two to address any questions or comments that you have. And I think, Miriam, you're going to help us with that.
Yes, hi. I have here on the panel a couple of questions here, and okay. Where can I have access to the resource collection? This question is by Stephanie Ruiz.
So you'll see at the bottom of this current page, if I'm understanding your question right, the whole collection is linked at this landing page, the one that ends Trauma-Informed Care Resource Collection. And then there's a opportunity to click each of those sub-pages or sub-collections. And again, at the bottom of each of those, there's a loop back to move on to the next one or to return to the landing page.
Okay. There's also
Let me know if that did not.
Yeah. Comments about the poll. Somebody said, Heidi Bell, several people said, poll is not allowing for choice for multiple options. I believe there is a great need for trauma-informed care in my area. Okay. Several people said that they couldn't select different areas. Okay.
Yeah, there must have been something in that poll that didn't quite work, but I appreciate that, and I think that's a challenge in lots of communities, not only just getting information to parents, but having trauma-informed services overall. So you're not alone. That is a challenge in a lot of communities. So thank you for sharing.
Yeah, I think the poll only allowed one choice. Okay, so another is the landing page for this. I think you already. Oh, at parentcenterhub.org. It is also housed there. The resources are housed here, as you see. So, somebody asked Cindy Dutch. At this time, was there a tree of life disaster? The Pittsburgh public schools were not prepared for these students and the trauma they might have experienced during this traumatic event. It's more like a comment. Okay. I don't see any other questions on this. Okay. Oh, no. Yes, another one from Patricia.
So, Miriam, I'm sorry, Miriam, can I just want to, so that question seemed to refer to the synagogue shooting.
Mm-hmm.
And I don't know if the question is whether or not there are resources that are specific to responding when there is a, when there is a so-called mass shooting, or when it's related to violence, violence in the community, whether it's sort of ongoing violence, or if it's something as, as immediate and large as a mass shooting. Gail or
Deborah,
Kelly? Mm-hmm.
this is Lisa.
Yes, Lisa.
The resource collection does have information on sort of violence, school violence especially, but it's not emphasized. I know in many of the places that are identified as helping children after a ... When you go into that collection of resources, you see all kinds of other things that can go on besides floods and hurricanes. And that's where people will find things about helping students, helping families cope with and recover from a school event like a mass shooting or what happened at the synagogue.
Okay.
The emphasis on disasters was more natural disasters, but some of the resources in there are identified. You'll see, it'll say, it's all kinds of events other than just natural disasters. So that's where the person who asked that question should look.
Right.
Thank
There's
you, Lisa.
another question here about if the resources are going to be available in Spanish.
Some of the resources have already been identified as being available in Spanish. If they were already created in Spanish, then Gail and Kelly noted that, and they are noted in the resource collection as well as being available in other languages, just as many of the other CPIR documentation that you're accustomed to seeing in there. It'll say also available in other languages.
Right. There are a couple of people who also raised their hand. Cindy Dodge and Debbie Kay have raised their hand. Maybe we can unmute them, but I have a couple of questions before that. So yeah, before we do that, let's continue here. There's maybe like a comment from Karen Lusk. Thank you for the tremendous amount of work that has gone into this research collection. It will make so much easier for the average person to find specific things needed about trauma and trauma-informed care. A question from Barbara Roth. When receiving services on IEP 504, there is usually an evaluation assessment completed to show the need. When a student needs services for trauma, does the family need an outside evaluation or assessment, or is it up to the school to provide?
This is Kelly. I'll take a stab at that, and then Gail, if you want to give your thoughts on that. I don't think any of that is specified in federal regulations, and certainly in our state regulations here in Virginia, there's not mention directly of a trauma assessment. Of course, the idea behind an evaluation or reevaluation is to get a complete understanding of the needs of the child that may be impacting their educational performance. So to the extent appropriate, and we work with this a lot with our foster, adoptive, and kinship families, a trauma-informed assessment done by a qualified clinician is information that should absolutely be shared with the evaluation team at the school if it's been done. In terms of whether the school should be conducting that, I think there's something about many school psychologists' readiness to do that. So I think an individual decision that the team would need to make in terms of what is the source of the most qualified provider of that evaluation But certainly if the family has that information from an outside source, that is something that they could absolutely share with the evaluation team as the family deems appropriate. And often those evaluations do include some set of recommendations, often at the conclusion of the report, that could be very valuable to the evaluation team and then to the IEP team. Gail?
And I just want to add, I think the biggest thing you have to really focus on is how much is that trauma impacting the education. And that's where then, if it is impacting the education, then it does become the school's responsibility to look at that trauma piece. And so if it is, then they can do an evaluation. We do have schools that will do evaluations around that, but again, that's not their expertise. And so therefore, a lot of times I encourage parents to take that, like Kelly said, get an outside evaluation and bring it to the school.
Okay, I have another question here on the panel from Monique Duju Wilson. Groups that I have worked with in the schools where there are active shooting drills wonder, how do children hide who may not be able to be quiet or hiding isn't accessible for them? So resources about that.
So are there
That's
resources about school preparedness that you all came across in the collection?
This is Lisa. I think that it is maybe tangentially dealt with in some of the materials, but not as directly as Monique stated the question. Certainly at IEP time, the parents should take this into consideration to talking with the team about if the individual, if the child doesn't really have the ability to be quiet. The school needs to have a plan for what to do, and they're required to have to do planning for emergencies like a school shooting or whatever. So that's something that would really fall under the IEP, and talking about it and recognizing that there are going to be certain issues if the school shooting thing comes up or the drill or whatever, and find a way to deal with it, but not by ignoring it or waiting till it happens. So no, Monique, there's nothing in there that directly, but if you look under the trauma and specific populations and the disability section of that, there are all sorts of discussions about how to integrate the child point of view into the IEP and deal with trauma through the IEP.
All right. So we have a couple of people who have raised their hand, and Cindy Dodge was the first one. So I'm going to proceed to unmute her. We have about 4 minutes in total for this part of the presentation. So let's, okay, Cindy, your mic
Miriam.
is on.
And just what Deb said, it was the fact that at the synagogue shooting, while this wasn't something that happened in the school, it impacted students who went to school in that area. And what we found through calls to the Peel Center was that the school was not prepared. So I was hoping that there were information about those kind of, in here I termed it disaster, and for us a lot of times it is. But a lot of these things aren't happening necessarily in the school. It's happening in the community, and we're seeing the children very impacted by it once they're getting to school. And unfortunately, the schools don't always recognize, the behaviors or what comes after the trauma. And we're finding that even our state doesn't have a lot of, this is much more information than our state currently has about trauma-informed care. So thank you very much.
All right, thank you, Cindy. Okay, I'm gonna proceed with the next person who was, hold on one second. Karen? Karen Lusk? No, I'm not sure. Yeah. Let me unmute you and then I'll continue. Karen, do you have any questions?
No, it wasn't me.
No, Karen Lusk. Not Danton, Lusk. Okay. Let me go to Angela Harris. Angela, the mic is ready for you. Okay. I think no. She removed the hand. Anybody else? Otherwise, okay, we did Cindy. I'm looking at the attendees list. Nobody else has raised their hand.
Miriam, this is Kelly. I will say, as we wrap this up, that since the issue of responding to crises and the variation of experiences that a child may be facing as a parent or caregiver or professional tries to support them. Without getting too deeply into the content, one of the points that are made throughout the materials that are in these resources that particularly for school personnel or other community-based folks that may be working with the child, it's not critical for the child to disclose the details of the trauma that he or she experienced, that it is enough for the professional or the supporter to know that a trauma experience has occurred and not need to sort of dig into that or rehash, re-traumatize the child. The strategies for supporting a child and a family who has experienced trauma are pretty stable, consistent strategies, sort of regardless of the nature of the trauma. So I think it's important that you as parent center staff is that we are able to send the message that you don't need to be a trained clinician. You don't need to get into the nitty-gritty and dig deep into the psyche of the child or the family to be able to be an effective supporter. So I hope that folks walk away using the tools from this resource, knowing that they're empowered to be supportive without necessarily getting into the deep dive of exactly the nature of the specific trauma, because the trauma response is completely individualized to that person's experience and perceptions.
Thank you, Kelly.
And this is Terry Layton from ECAC, and I know Laura and I were listed on here as having some sort of participation in this resource collection, and I feel like I just want to give a big shout out to Gail and Kelly for really driving the project. They did a tremendous job, and I wanted to thank them publicly for all the effort that they put into it and organization. And they put together a beautiful resource collection for the parent centers, and I really hope that you get out of it what they put into it and more.
Thank you. So we have the next slide. I think we're going to move to the next presenter. So Karen, now you have the power.
Okay, I'm just getting my screen ready to share.
Yes.
Okay, so and now we should be looking at the actual web page for the guide. So hi everyone, I'm Karen Antone, and I will be spending the next 20 minutes introducing the newly developed and released National CPAC Guide, Advocacy in Action, a guide to local special education parent advisory councils. There will be an opportunity for questions and answers after the session, and we will also try to answer questions posted in chat. I'm now sharing to my screen the website hosting the National CPAC Guide. The guide will be hosted on the SIPR website, and what you're seeing now is a temporary link. So you'll find the permanent link in the chat area. The guide is available online and downloadable as a PDF as well for printing. When viewed on a computer, the links for information, forms, and resources will be live. Okay, so as we scroll down the page, you'll see a message about the importance of teamwork from Deborah Jennings. She's the director for the Center for Parent Information and Resources, and also the executive co-director of the SPAN Parent Advocacy Network in New Jersey. Deborah mentions that at the core of the Individuals with Disabilities Education Act, lawmakers and advocates establish a team approach in which parents and educators working together review challenges, explore options, and make decisions in the best interest of each child. The very teamwork and collaboration that are at the core of IDEA are also at the core of a best practice in special education. Local Special Education Parent Advisory Councils, otherwise known as SEPACs. An effective SEPAC takes the teamwork of the IEP process one step further, putting parents in the role of advisors who use their family's experiences, unique perspectives, and expertise to influence decisions and help shape programs and policies at the local level. An effective SEPAC is more than a meeting. It's an approach and a mindset that truly values the advice of parents. When parent advisors are valued and engaged through local SEPACs, they can work together with school district staff and community leaders to improve education, not only for those with disabilities, but for all children. To the right, you will see that the guide was produced under the U.S. Department of Education, Office of Special Education Programs. Here with us today is a project team. Myself, Karen Antone, assisted by Miriam Alizo, who will be helping with chat, and Deborah Jennings, who will assist with questions and answers following the overview of the guide. Next is the section on how to use the guide. The Center for Parent Information and Resources offers this guide as a roadmap for parent centers to help bring stakeholders together, suggest strategies to help them engage in dialogue, and discusses best practices to help them work together to benefit the local community. It draws on experience and practice from states in which local CPACs have been in operation for decades. Some states now require school districts to establish local CPACs, but most do not. But even in states where they are not required, progressive families and education leaders have established local CPACs that have become an asset to the school community. Because each state and each school district is different, many choices are left up to each community, presenting both challenges and opportunities. The challenges are for each school community to develop and run a local CPAC that is aligned with the unique needs of the school district, bringing in diverse perspectives and setting the tone for productive discussion, collaboration, and responsive change. The opportunities to improve the school community, climate, and education for all students is boundless. So as you can see, the guide is divided into 3 parts. Part 1 of the guide is designed for parents, state agencies, local education agencies, and school leaders who are interested in establishing and running an effective CPAC in their local school district. It can be used to start a new group or to strengthen existing collaboration as a means to improving special education services and outcomes for students with disabilities. Part 2 of the guide is designed for staff at parent training and information centers, community parent resource centers, national parent technical assistance centers, as well as statewide leaders and advocates who are interested in supporting existing local CPACs and or helping to build support to establish local CPACs. Then we have part 3, which is the resource section, which includes organizational forms and resources available in PDF that CPACs can download and print, or the option to download as fillable forms in Word. The Word version can also be downloaded as a Google Doc, to be used as a collaborative document and shared with members within their group. So then we go to the acknowledgements. The acknowledgement section shares and thanks the countless families whose interviews and stories help inform part 1 of this guide, and to the school leaders whose advice and expertise helped to shape its content. We also thank the scores of parent center leaders who responded to our survey and who took part in the phone interviews to help us bring a national perspective for part 2 of this guide. There is a listing as well of the parent center leaders interviewed or sharing state-level research to help develop this guide. And then as we scroll to the bottom of the screen, you can see the reprinting permissions, links to visit and contact the Center for Parent Information and Resources, along with a search engine to search by topic. So now we're going to scroll back to the top and go to the table of contents. Okay, so as you can see here, we can download a full PDF of this guide. So we're going to go there now. So in the table of contents, you can also click and go to any section you're looking for directly in the guide. So here is the actual guide itself. So it opens with a table of contents, and that is followed by the introduction, how to use the guide, and acknowledgements that we saw on the home screen for the guide. So I will be going through the guide, providing an overview. The guide will be posted on the SIPR website, and Miriam will share the link so you can go through the guide in greater detail following the overview. So I'm going to go through it pretty quickly. So part 1, a guide for local action. The guide is
A little bit
Interrupt you one
like
second.
yesterday.
Oh, I'm sorry. I don't know why it goes from 100
There we
to
go.
75
Thank you.
when I go into the guide. Thank you. Thanks for that reminder. So part 1 is the guide for local action, and the guide's organized with the chapter Readers Will Learn section. And this chapter defines what a CPAC is, followed by the purpose and function of effective local CPACs, along with the membership suggestions with an emphasis that parents are the core members of CPAC. Oops. Okay. So then we have requirements for CPAC, how CPAC is different from other groups and why parents should get involved. And we close chapter 1 with the benefits of CPAC, along with chapter 1 takeaways. Every chapter in this guide closes with a takeaway section highlighting key points from the chapter. Chapter 2 is the value of parents as advisors. In this chapter, we are defining parent-driven with an emphasis on the importance of parent engagement, input, and mutual respect within the group. Here are some examples of questions to guide attitudes of group members coming from different perspectives. Then we have the difference between individual and systemic issues and how to move from an individual issue to a systemic change. Okay, chapter 3 focuses on starting and structuring a local CPAC. It includes a quick start guide. And on this page, take notice of best practice, tools for change, and tips as guidance that are infused throughout this guide. Okay, whoops, sorry. So then we have information on building and maintaining parent engagement to include the diversity and all members of the district community. Okay, then we go to collaboration and partnerships. Here we have the suggestions for parent and district initiation of CPAC. Some tips for strong collaboration. Then we have some strategies for resolving conflicts and disagreements within the group, and some suggested member roles and responsibilities. Okay, chapter 5 is about gathering parent input. What is parent input and strategies for gathering input? Then we have communication strategies for CPACs, and how to support diverse parent participation. Chapter 6 is about turning ideas into action. Some suggestions for topics for input. The importance of setting priorities. And followed by accessing the impact of the CPAC's work and indicators of a quality group. Sorry, just a minute. Okay, so let's see, that's the end of chapter 6. Sorry, I made a little mess with my pile of notes here. Okay. Okay, so, and then also how to use different strategies for system change based on the issue. Chapter 7 is about strategies for running an effective meeting. So that has some organizational tools. The importance of using agendas and minutes. Then we also have a little section on coming to consensus. How to help new parents feel welcome. Some ideas for some ground rules for meetings, and how to build some outreach. Okay, strategies for strength and growth is chapter 8. So this is all about setting priorities, annual goals, and meetings. These are some other tools that can help with setting up your group. And that is the end of part 1. Next, we go into part 2. And if you notice, the color actually changes for the different sections to help people have an awareness of where they are within the guide. So this section is a resource section for supporting local special education parent advisory councils. And this section is for the parent centers to use to support the groups. So first we start with a view from the states. So this is the information from the handful of states and what their current status is on how they how CPAGs are in their state groups. So these are active groups within the different states listed here. And you can see interspersed within this some quotes from parent center leaders that were interviewed for this process, along with some quotes from different guides from different states. So these are some of the ways that the parent centers do support parents as local as advisors. And again, with some more quotes. And then here we have tools for change. This is the Every Student Succeeds Act information. And in our resources, there's a link that goes directly to the different ESSA plans from the different states. And I'd like you to note here as well, there's a tip that the parent centers can access funding through the local district or state ESSA plan to help develop CPAGs at the local level. So you can speak with your state or district leaders, and they might possibly fund your center to help with CPACs and parent engagement within those areas. So, and then here are some ideas for building partnerships and strategies for engagement to build these partnerships within your states and local districts. So part 3 is the resource section. So here we find, whoops, sorry, that scroll wasn't good. Live links to resources, everything from ESSA plans in every state, information on supporting group diversity, family engagement, and developing partnerships, and organizational tools for running effective meetings, including serving on groups and World Cafe. Then we have the process for developing section 2 of the guide. And then we get into the actual tools themselves. So we have the local CPAC startup checklist. And remember, you can download these forms in PDF or in fillable Word. So when you're helping a group or when a group's asking for some tools, you can share them with them. So then we also have a sample CPAC job description, which is helpful when forming groups so that people have a clear understanding of their role in the group. Sample CPAG mission statements. Sample copy for a flyer. Some sample CPAC bylaws. And then here we have an example of how to use an action agenda, followed by a blank action agenda for groups to use, a CPAC input form, workshop reflection, an action planning worksheet, and some forms for self-assessment of the group. So this is the end of my part of the presentation. Thank you, everyone. I will now turn over the presentation to Deborah Jennings for questions and answers.
Thanks so much, Karen. That was a really very flyover overview of what is a really rich resource full of content around putting advocacy into action through local special education parent advisory councils. If there are questions about the guide, please either raise your hand or you can post them in the question box.
I don't see any questions at this moment, Deborah.
Okay.
Topic, but let's see if people have any question. Yeah, somebody asked right now, Kristen Brown, are these resources included for data research? That's a question. Or are there resources included for data research?
Kristen, can you tell us a little bit more about that?
Yeah. Kristen, maybe I can unmute you. I can do that. I'm going to unmute Kristen Brown. Kristen,
Thank you.
Okay.
Hi. I guess, you know, my frustration, I'm a chair on a community advisory committee for special education. And I feel like I've been to a lot of advocacy and action forums, but it never seems like there is an offering of if you're looking for data to support your argument or towards solutions, you know, some of those resources. So I was asking if there are any resources included in this guide. I haven't had a chance to thoroughly look at it yet.
So Kristen, one thing you might want to take a look at, and I'm not showing the guide right now, but on the resources page, one of the resources that you can access is actually is part of the SIG network, which is the network of states with state professional development grants. And within that resource, there are a number of resources that you can use for evaluation and assessment of family engagement, family involvement, and all the ways that families are engaged. You'll see in that resource that there's information around building partnerships, as well as in collaborations and advocacy. And there is a section that's specifically dedicated to evaluation and assessment of programs and projects. There are some other resources in there also about how to, about collaboration and working together to solve problems that I think might also be helpful for you. And if you go in and you don't find what you're looking for, definitely feel free to reach out to either the SIPR or to your regional Parent Technical Assistance Center provider.
Thank you.
You're welcome.
Okay, there's another question here from Sue Public, and the question is, in states that have laws requiring CAC-SE, in parentheses CPAC, how does one convince the district that they must cooperate?
I guess it's always about the definitions and whatever your regulations are. Fortunately or unfortunately, local education agencies will look to what is in the regulations. Often as parents, and particularly as parents who are really committed to being partners in school, those regulations may not go far enough. If your perception is, or the reality is, that the local education agency is not following the regulations, and with your conversations with them, your advocacy, they seem to still be resistant, your only option may be to actually complain directly to your state education agency.
Right, and Sue comments further information. There has been nothing other than resistance and attempts to deny successful, unfortunately, the committee's desires and the rights to participate in the development and implementation of the local plan for the special education. And she said, exactly, not following regulations.
Yeah, so in that case, then you're going up the chain of command, and if you exhaust the chain of command at the district level, then your next point, it would be going to your state education agency. Because often your school boards and or your school superintendent may not necessarily be as aware of what the requirements are and or as aware of your struggles. So, I suggest that you first try to address the need locally, and then if that is not, if they're still not following the law, then you would proceed to the state.
Okay, there's a comment from Laura Nata, and she says, excellent guide. Thank you all. So thank you, Laura.
And thank you, Laura. As some of people may have noticed, thank you for your contributions to the guide, and also for your being an example for the rest of us at the Parent Center Network around putting that advocacy into action at the local, state, and also the federal level. So thanks, Laura.
Okay. A comment from Rosemary Arnon. Thank you from Buffalo. We love our Parent Center. Sue Barlow rocks. Nice.
Oh, I agree. Sue Barlow rocks. Thank you. Thank you for those kudos. We can use them. Us in the Parent Center Network, we can use the kudos as many as we can get. Thanks so much.
There's a comment from Leah Holly. Thank you for the wonderful resources. It is an invaluable tool.
Yes,
So
and thank you for the compliment, Leah. I don't know if there are any of you who are on the line who might want to, share some of the ways that you're thinking about using this resource, and also using the resource collection on trauma-informed care. I think your colleagues that are here, if we have a few more minutes, might appreciate some of the ideas that are rolling around the Parent Center Network about how to put these resources to work.
Yeah, so click on the hand icon, and I will unmute you. Right?
Okay, don't be modest, because I know you guys are doing some great stuff out there.
Yeah. Okay.
Okay, well, I'm sure you'll be thinking of some things. Miriam, do you want to, I'm sorry, Lisa, do you want to go to the next slide now?
Okay.
So just a reminder, here's the link where you can find
Sorry. Yeah, I'm sorry, I didn't see Monique is raising her hand and she's commenting that. So I'm gonna unmute Monique. Okay. Hold on 1 second. I need to find you, and I don't see your raise, but here you are, Monique. Hold on 1 second. Monique, the mic is yours.
Hi, good afternoon. I really like the guide, and I thought that the self-assessment is a great tool to start a discussion And I thought of a particular district that I'm working with in particular where the CPAG wants to be very much in line with input that's coming from the community, and they're having some conflict with their director. So I think that this assessment and doing a self-assessment and trying to find a comfortable way to start that discussion and having to come together might be a great way for them to start, because that's their issue. They don't know how to come to the table and come together in a way where there's not a lot of conflict. So I think that this might be a great way and an honest way, and numbers don't lie, to kind of start that conversation for them.
Very good. Thank you, Monique. There is a question, actually two, from Sue. Will the webinar be available as recorded? Yes, it's been in recording right now. You will get the link. And another one, is there an area that compares states with regulations around CPACs and how they are to be set up? That's a question from Sue Pavlik.
Yes, and I know that we really moved through the guide really quickly, but in that section 2, there are several pages that are dedicated to sort of outlining the various states that have some form of requirements around forming local special education parent advisory committees, councils, etc. And so when you look at the guide, when you're looking at the guide, you can go to the table of contents and scroll down to part 2, and in part 2 you'll see where it responds to your question. So that information is right there in the guide for you.
And there's a comment
and
from
if you're in a state that doesn't have, and if you're in one of those many states that doesn't have any regulations around CPACs, though that information is going to be really helpful for you as in terms of your efforts around advocating for having some frame and or some policies or guidance or laws around local groups or councils.
Okay, perfect. There is a comment from Rosemary Arnon. The Buffalo Public Schools will share these materials with all 18 CPAC parent representatives. What awesome resources. Thank you, Rosemary.
Fantastic.
And put all the comments on the survey that you will get a link very shortly.
The link,
and Rosemary, I'm sorry, just want to interrupt 1 second. And Rosemary, I was, in fact, I'm at a meeting in DC right now, and my understanding is that there is some work being done in the Baltimore Public Schools around trauma-informed care that you might want to do a little research on and look at how your parent center can be involved in and support that work in Baltimore if you haven't already had a chance to do that.
There's a comment from Leslie Girard. These resources are very timely for us. Thank you so much. Our SPDIC work is focused on school mental health. And also, she also says, we also have had recent resurgence of local advisory groups. So helpful. That's from Leslie Girard, too.
Thank you, Leslie.
Mm-hmm.
This is Lisa. I just wanted to say that the link that you can see on this page, that is where the archive will be of the webinar. It's not live yet because we want to be able to put the actual archive of the recording there, but you'll be able to see it. It'll pop up on the front page of the Parent Center Hub under webinars, and then you'll know it's live. You can come and visit it.
Right, but the link that I posted on the chat is It Works. The one that Karen gave me earlier.
Right.
Mm-hmm. Yeah, I had some comments that it wasn't working for some reason, but it works. I just set it on my cell phone. It works.
Excellent.
Okay, thanks so much, everyone. If there aren't any further questions or comments, it's probably time for us to wrap this up. I want to, again, let you know that we will have this webinar posted. It is being recorded. And then once we have the recording, then we will get the closed captioning, and we'll be able to post it for you to access. The resources are also will be available on Parent Center Hub. And again, if you have any questions or need further information, please feel free to reach out to us and or to reach out to your regional technical assistance centers. I really want to thank all of our presenters. Thank you, Gail and Kelly and Terry and Karen. Big kudos to you for the work that you've done to pull these resources together. I want to thank Lisa Cooper for being the product developer extraordinaire who, when we come to her with our sort of piles of papers or piles of resources, that helps to put it into really understandable and easy to use and access formats and designs. I also want to thank Considine Communications, who did a super job on the design of the Advocacy and Action guide, and really helped us in terms of sort of expanding our thinking on this guide to make it into a national, a resource that would be really useful and national and reflect the work that's being done across so many states. And thanks so much to Miriam Alizo for helping us to with getting things really organized and structured, and keeping this webinar moving, and being the technical support that we need when we're doing these webinars. So again, thanks everyone for joining us. You will receive a survey about this webinar. Please provide us with your feedback, and also provide us with your some ideas and suggestions for our future CPIR resources. We use these webinars primarily to offer to you and to let you know about the resources. If you have ideas and suggestions, please let us know. And also, please let us know the great things that you're doing in your centers that we can build resources around, so that they can be shared across the network. Again, thank you, everyone, and have a great rest of the week.